Good morning and welcome to a show we like to call Rise and Unwind, the show where we catch up on things everyone's talking about, from entertainment and lifestyle trends to helpful tips that can make your day just a little bit better. My name's Kayla, and this week we've got this.
But in order to take full advantage of all of your benefits, you need to know what's included in your coverage.
Those include severe pain, often described as the worst pain in the world.
All that and more right here on Rise and Unwind.
What if you could experience Elvis in a way you've never seen or heard before? A new cinematic event from director Baz Luhrmann brings rare footage, restored performances, and unheard recordings together in something that's not quite a documentary and not just a concert film. It's called Epic Elvis Presley in Concert. Baz Luhrmann joins us now to talk about his new big screen experience. Baz, welcome to the show, my friend. How are you?
I'm good, Dan, and I love the way you described it as a cinematic event, because people are having trouble to sort of say what it is. That's what it is. This weekend, 1,900 screens all over the US. Get out and have a cinematic event, because that's what we tried to do. That's what Elvis is.
And during the making of Elvis, you went searching for rumored lost concert footage, and actually found dozens of boxes that hadn't been seen in decades. What did that discovery like for you?
Oh my God! Literally, we thought we'd find a reel, and we went down to these salt mines in Kansas City where they stored negative. Bang! There's 65 boxes. And 1635, some 8mm. And Peter Jackson helps us bring it back to us to a level of quality. I mean, just get to the biggest screen you can in your town. It's in every town this weekend. Just get out there and see it, because it is actually, I've seen it enough now. People like applaud during it, they dance during it. This is a movie you can really bother the other patrons, bother them with your noise and your energy, because that's what it's for.
And this isn't simply a restored concert film. You described it as almost a cinematic poem. How did you approach shaping Elvis's life story through this dreamlike concert experience?
Well, when I was working with my creative partner in this, John O'Redman, we found this one box, and in it, Elvis is just recorded, unguarded, telling you about his life story. And we said, no talking heads in this. Let's just have Elvis come to you in a dream and tell you his story really unrestricted, and music and sing along and concert moments, and he rocks out in it. Now sonically it's in 5/1. Everyone just says it sounds like it was recorded today, and the audiences are reacting like that. This is the concert, the world tour that Elvis never actually had. He dreamed of having one. He never got outside the US. As we're speaking, he's in 5,000 screens all around the world right now.
And for audiences who think they already kind of know Elvis or absolutely loved your film from 2022, what makes Epic a completely different experience on the big screen?
I go on YouTube and just see what fans are saying. They'll tell you. They're going like, I thought I knew him, and now, but it's his humor. He's so goofy. He's so disarming. And then just you see him creating the music. Like you see him take a song like Bridge Over Troubled Water, Simon & Garfunkel, and turn it into this like gospel powerhouse song. And, he's so unpredictable. And I think people are, even hardcore fans are going like, one guy said, he said it beautifully. He said, this is the film that Elvis always dreamed of making, but 50 years after his death, he's finally in it.
Baz, I want to thank you for joining me today. Epic Elvis Presley in Concert is in theaters now. You can find showtimes and tickets at your local theater and experience Elvis like never before. Baz, it's been a pleasure to have you on here, my friend.
Yes, my man. You're cool.
Have you ever wondered if you're really using all the benefits in your healthcare plan? Now that 2026 is underway, a lot of people are starting to schedule doctor visits, refill prescriptions, and figure out what their coverage actually includes. For people who qualify for both Medicare and Medicaid, there are plans designed to help coordinate care and sometimes even help with everyday costs. Joining us now is Marian Cabanillas with United Healthcare to explain how these plans work. Welcome, Marian.
Thank you. It's a pleasure to be here.
So for people who may not know the term, what exactly is a dual special needs plan, or a DSNP, and who is it meant for exactly?
Yes, so dual special needs plans are also known as DSNPs, and they're for people with Medicare and Medicaid who may need just a little extra help because of their income, because of a disability, or just because of their health needs. And I know that coverage can sometimes feel complicated, especially when you're new to a plan. So what we want to talk about today is getting to know how the plans work and also where to go for support. But one thing I do want to make sure everybody knows right off the bat, with a DSNP, you will not lose your Medicare or Medicaid coverage. And DSNPs include care coordination that can help support you throughout the year.
And as you kind of just mentioned about these plans, including care coordination, how does that help someone stay on top of doctor visits and preventative care?
Yes, great question. So most people that are eligible for DSNPs manage at least one chronic condition. And that's why care coordination is such an important part of your benefits. Some examples of how care coordination can help, they can do things like track your doctor's appointments, support your medication needs. They can connect you to services like caregiver or housing support. And they can even help you stay current with preventive care, which is so important to help you catch health issues early. So things like colonoscopies, or mammograms. Those things are really important to keep you healthy. I do want to remind people that now is a really good time to schedule your annual wellness visit with your doctor. And if you don't have a primary care doctor, that's okay. Just contact your 1-800 number on your ID card for your health plan, and they can help you find a doctor that's in network.
And some viewers may not realize these plans can actually also help with everyday needs. What kind of support might be available?
So this is where I think that these DSNPs really shine. Not only do they include your basic Medicare drug coverage, but many of the DSNP plans also offer additional benefits, things like vision and hearing screenings, dental checkups and cleanings. They can even include things like rides to and from your doctor's appointments. They can help with over-the-counter items like pain relievers. And for people that qualify due to chronic conditions, some of these plans can even help pay for healthy groceries and your utility bills. So it's really important because it can help you maintain your health and independence. But in order to take full advantage of all of your benefits, you need to know what's included in your coverage.
And what are a few easy tips to help people better understand their coverage and maybe make the most out of their DSNP plan?
Yeah, first things first, you really need to review the plan materials that are mailed to you. But I also understand that that can be kind of overwhelming. There's a lot of information in there. So you can always call the 1-800 number on your health insurance card, and there's folks there that can help answer your questions about your coverage. There's 3 really important questions that I think everybody should ask. First, have your list of your preferred doctors and hospitals, and make sure that you ask whether or not they're in network. Second, make sure that you know what all of your prescriptions are and whether or not they're covered. And then last but not least, make sure that you ask what additional benefits are available to you. Again, the more that you know about your plan, the more confident that you're going to feel using your coverage.
And if any of our viewers want more information or want to see if they qualify, where should they go?
Yes, I would recommend you visit getdual.com, and there you can learn more about how these DSNP plans work. Again, it's getdual.com.
Marian, I want to thank you so much for being here this morning.
It's my pleasure. Thank you.
Kidney stones are one of those health issues that can hit fast, and they're no joke. More than 500,000 people land in the emergency room every year because of them. With March being National Kidney Month, we're talking about the symptoms, the risks, and what treatment looks like today. We're joined by Dr. Jared S. Winoker, a New York City-based urologist, and patient Crystal Jefferson. Thank you both for being here.
Thank you.
Thanks for having us.
So, Dr. Winoker, what are kidney stones and what symptoms should people really pay attention to?
Sure. So kidney stones are actual rocks. They are rocks that are formed from the minerals that are typically dissolved in your urine. And they'll grow up in the kidney until the day comes where they move and they block the drainage of the kidney. And then you can get some pretty noticeable symptoms. Those include severe pain, often described as the worst pain in the world. It's not uncommon to see blood in the urine, potentially some serious nausea or vomiting, and at times a fever, which may suggest an underlying infection. But I do also want to note that we also detect many stones incidentally up in the kidney before symptoms, and those may be caught, say, on a CAT scan or a sonogram performed for another reason, which gives us an opportunity to potentially intervene at an earlier date before you end up with any of those symptoms.
And what treatment options are available right now, and how is the new CVAC system improving the experience for patients?
Sure. So there are a number of really great minimally invasive options out there to treat kidney stones, things like sound waves and breaking up the stone with a laser. The challenge with these treatments is that they don't always effectively get rid of all the stone inside the kidney, and those stones can grow and cause more problems. The CVAC system really has revolutionized the way we're treating kidney stones now. It's an all-in-one, minimally invasive option. It's inserted into the kidney where we can break up the stone and, importantly, actually vacuum out all of those pieces that would potentially be left over after treatment, rendering the kidney free of stone and avoiding future problems. So it really has been a game changer for me and my patients.
And Crystal, what was your personal experience living with kidney stones?
I was in 2009, a patient that showed up in the ER with vomiting and excruciating pain. I passed stones, however, stones kept reoccurring. I knew something was wrong when I couldn't stand up for long periods of time, when I couldn't drive for long periods of time. So I knew I needed to get help. I sought out a specialist, Dr. Winoker, and Dr. Winoker went over with me my particular staghorn stone, which is a more dangerous, serious type of stone. And he explained to me all the various options. The CVAC system was one of them, and I chose the CVAC system because I was a good candidate for it. And post the procedure, my body responded well to the CVAC system.
And after going through treatment with the CVAC system, what would you tell someone who might be nervous about getting help?
Don't be nervous about getting help and trying anything new. It was an outpatient procedure. I did have to take general anesthesia. I did not have to be admitted, and my recovery was quick for me. And I got back to standing up on my feet for long periods of time and taking long drives without a problem. I wouldn't hesitate to do it again.
That's great to hear. And Dr. Winoker, where can our viewers go to find more information?
Absolutely. There is a wonderful website out there called surewithcvac.com. It has great information, not only on this CVAC treatment we're discussing today, but also on kidney stones in general, as well as the available treatment options out there. So we encourage people to visit that.
Dr. Winoker, Crystal, I want to thank you both for being here today.
Thanks for your time.
Thank you for your time.
GLP-1 medications have changed the conversation around weight loss. A lot of people are seeing results, but doctors say medication alone isn't the full picture. So what actually makes it stick long term? Mistie Mace has finally seen success after years of trying, and Dr. Michelle Gourdine, Chief Medical Officer for CVS Caremark, is here to explain why a whole person approach actually matters. Welcome to the show, you two. How are you?
Good. How are you?
I'm doing pretty good. Mistie, you've been on this journey for a while. What's it been like for you personally?
For me, it has been a journey. It's been up and down. I've had some plateaus, I've had some highs, and I've had some lows. I developed obesity in elementary school, and we could just not figure out what was going on. I was active. I was always outdoors, but I started becoming tired. And after school, after high school, we learned that I had thyroid cancer. And so I had my thyroid removed and went through years of radiation treatment. Then I became a wife, a mom. I have a special needs 19-year-old son. And then I became a nurse. And in teaching my patients, I had to practice what I preached. And so how can I, in this appearance, teach someone about weight loss when it appeared that I wasn't even doing the same? But it was a struggle. And so I decided I need to get some help.
So at what point did you decide to try a GLP-1 medication? And why did this time feel different from some of your previous attempts?
Well, I had tried different fad diets. I had been counting carbs. I had been trying the, fad diets of so many points for this and different things like that. And so I joined CVS's weight management program and I got a health coach. And in working with my health coach, I realized that we had to make behavioral changes and habit changes. And then after I accomplished that and was doing really good with that, we added in my physician. And I had the conversation of, was this medication right for me? I have other things going on. I'm a diabetic. I have high blood pressure and high cholesterol. And so we had to think about those things. And in talking with my physician and a specialist, we decided that a GLP-1 was right for me. So we started low on a dose, and then gradually I've worked my way up. I'm not approaching it fast. I'm approaching it, low and slow, and that way. And then I had to develop a support system. So outside of my health coach and my physicians, I had my family support. And my husband's my biggest fan, and he's my biggest support. And we all had to make a household change in order for this to be successful for me.
And Dr. Gourdine, we hear about the early success in these medications, and I've had friends be successful, but research is showing that results don't always last. So what should patients be understanding about some of these realistic long-term expectations?
Yeah, GLP-1s are really revolutionary drugs. They drive a level of weight loss that we've just not seen with any other drugs that came before them on the market. And this is relevant in today's times because, frankly, we have an epidemic of obesity in this country. And it's really important for me to say this. Obesity is not a failing of willpower. What we know about the science of obesity is that the body is actually wired to prevent us from starving. And so for many of us, just eating right and exercising and losing weight really triggers in the body sort of a warning signal, like, whoa, 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 this person is dropping their weight below a set amount. And so the body then slows down the metabolism. It increases feelings of hunger in order to keep that weight back up. That's why for many people, eating right, exercising alone don't work. The GLP-1s come in and sort of flip that script. So what they do is they keep the metabolism high, they keep the feelings of hunger low so that you can reach a healthier weight. But what we also know is that that medication and the sort of impact of that medication does not last long enough. You really do have to couple that with changes in your behavior, changes in your habits, as Mistie stated. And we also understand that people need support in fitting those changes into their day-to-day lives. And so what we do in our CVS Weight Management Program is we combine access to the medication to the support that people need to make those day-to-day changes. And we know that that combination of the two drives long-term success.
And speaking of changes, Mistie, you've made some day-to-day changes to build that support. What are some of those things that have helped and build those long-term goals?
As I said before, the habit changes, that was huge for me. And by doing that, we changed how we shopped. We changed how we cooked. I'm a Texas gal. We cook things, meat and potatoes. Everything is breaded, things like that. And so I had to really think about how I was going to approach it. And now I'm over 57 pounds, down 57 pounds today. I no longer do insulin. I no longer do my diabetes medication. I still work with my doctors, and just being honest and accountable. Accountability is rough, but that was the huge and the biggest change for me, was holding myself accountable for the choices that I was making. And now I'm rocking it. I'm ready to keep going.
And Dr. Gourdine, for someone in Kansas that's considering a GLP-1 medication, what conversation should they be having with their healthcare provider just to decide if it is right for them?
Yeah, there are a few things you really should talk to your doctor about. First of all, having that conversation as to whether or not GLP-1s are safe for you, whether the doctor believes they're going to be successful for you, is a shared decision that the two of you need to make before starting on this medication. Secondly, side effects. People are concerned about the side effects of these medications. Most of them are minor, but inconvenient. And there are ways to manage those side effects by the doctor adjusting the dosing so that, again, that dialogue between the doctor and the patient ongoing is really, really important to minimize the side effects. And frankly, most people end up feeling better over time with those adjustments. The third thing is cost. These drugs are expensive. And so a question as to whether or not your insurance will cover these drugs, that's something that needs to be discussed, or if there are other ways to make these medicines more affordable. Because if the medicines aren't affordable, people aren't going to stay on them. And if they don't stay on them, they're not going to work. And then finally, what's your commitment to that long-term sort of changes in your lifestyle and your behaviors and your habits that's really going to be necessary? Because at the end of the day, the medications kickstart the weight loss process, but it's really those lifestyle changes and behavior changes that drive towards long-term success.
All right, so where can people go if they want some more information?
They can go to cvshealth.com.
I want to thank you two for joining me today.
Thank you.
Heart disease is still the #1 killer in the United States, and millions of Americans are taking statins every day to lower their risk. But new research is showing a lot of people may not understand how those medications affect something called CoQ10, an enzyme that plays a key role in heart health. Dr. Tania Elliott is a dual board-certified physician, internal medicine and immunology, and she's here to walk us through what this new study found and what patients should be discussing with their doctors. Welcome to the show, Dr. Elliott. How are you?
I'm doing well. Thanks for having me.
Okay, so first, what exactly is CoQ10 and why does it matter so much when we're talking about heart health?
So coenzyme Q10 is a compound that is essential for our muscles to create energy and for our muscles to function. And the highest concentration of coenzyme Q10 is in our heart, which is a muscle. Lots of people think, oh, your heart's an organ. Well, it's actually a muscle, right? And it needs lots of energy and it needs lots of coenzyme Q10. Now, the issue with CoQ10 is it decreases with age. It's not just found in the heart muscles, but it's found in other muscles in the body too. and it decreases with statin use. Now, statins are really important to be on if you have high cholesterol and you have risk for cardiovascular disease. Over 90 million Americans are on statins. They're super important medications, and they're really good at lowering cholesterol levels, but they also inadvertently lower our coenzyme Q10 levels.
And you're releasing new study results. What stood out most to you?
So the study was conducted by a leading supplement company called Doctors Best. And what they want to understand is what are people's general understanding of their risk for heart disease and what to do about it. And the study revealed that over 60% of people didn't even know their heart disease risk, which is wild because we know it's the #1 killer of Americans, and one person dies every 34 seconds from heart disease. The second thing it showed is that 50% of Gen Zers, so these are people under the age of 30, were worried about their heart, and they cited stress and chronic stress as that major risk factor for not feeling well, for having low energy, and for feeling fatigued. And we know stress is a risk factor for heart disease. It also showed that 17% of those Gen Zers, so these are people under the age of 30 that we, in our minds, think are healthy, right? 17% of those survey respondents were on a statin for their cholesterol and to protect against heart disease. And very few people knew anything about this correlation between being on a statin and that statin lowering CoQ10 levels.
All right, for somebody out there that is thinking, okay, what do I do with this? What conversation should they be having with their doctor to lower their heart disease risk?
First things first is understanding your lifetime risk of developing heart disease. And so getting your cholesterol levels checked, being checked for diabetes, which is an independent risk factor for heart disease, and then having a conversation with your doctor about any other tests that you should do. There's an imaging study that could actually take a picture of your heart to determine whether or not you've got plaque buildup in your heart. And there are other blood tests that are a little bit more precise at helping you identify what your lifetime risk is of cardiovascular disease. So now we've got awareness. The second piece is understanding the relationship between statins and CoQ10. And that's really a conversation with your doctor to say, hey, I'm on a statin. Is CoQ10 supplementation right for me? And usually I say to patients, hey, just eat your supplements, get it from your diet and food. But the highest concentration of CoQ10 is found in organ meat. So I found that to be kind of a hard sell for my patients to recommend eating organ meat every day. And lots of them prefer the supplementation. So chat with your doctor about it. We understand that people who are on CoQ10 supplementation actually have better cardiac outcomes.
You're right. The joys of snacking on organ meat is not something I go for. All right, so where can people go if they want to read more or learn more about this research?
They can check out doctorsbest.com to learn more about CoQ10. They have a CoQ10 supplement that's bioavailable. You want to make sure the supplement you're taking is actually something your body can use, so that's important. And also just general stats and information about heart disease and what you could do to lower your heart disease risk.
Dr. Elliott, I want to thank you for joining me today.
Thanks for having me.
AI isn't coming, it's already here. And for a lot of businesses, the question isn't if they should use it, it's whether they're actually ready for it. From small shops to major corporations, leaders are trying to figure out how to make AI work without wasting time or money. And Gene Marks is a Forbes technology columnist and the author of the AI Business Playbook. And he's here to break down what businesses really need to know. Welcome to the show, Gene. How are you, my friend?
Dan, thank you so much for having me back on. It's great to speak with you.
It's great to have you here. You've written the AI Business Playbook for leaders trying to navigate this moment. What makes your approach different from some of the other AI advice that's happening out there?
Sure. So first of all, I think as you mentioned, I've been writing and covering technology for Forbes for the past 20 years. The past 3 years, big surprise, has been nothing about just AI. And it's a business book. And this book it's targeted at employees, professionals, managers, business owners, leaders of businesses. It's trying to separate the hype from reality in 2026. People want to invest and use AI, but they're not quite sure where to spend their money and where to spend the time. So the book itself, I dig deeply into practical applications, practical advice, as well as real life usage, real world, how the AI is being deployed so that business owners can think harder about it and decide what they want to do or what they don't want to do with AI in the next year or two. That is the aim of the book.
So when you're talking to business owners right now, what is the biggest hurdle they're facing when it comes to actually implementing AI in a smart way?
By far, Dan, it's fear. Everybody's terrified of AI. We in the media do nothing but perpetuate this fear, of course, because it gets more clicks. And it's just not right. AI is going to have an impact on some jobs, but I don't think it's going to have the same impact that a lot of people are scaring us about. more importantly is that generations are concerned. Cox Business, who partnered with me on this book, they did a workplace technology survey. They found that a third of Gen Z and millennials expressed concerns about AI, and half of Gen Zers, I mean, it's the youngest generation, Dan, they feared AI could just replace their jobs. And so we as employers and as managers need to work hard to get our employees over this fear, to let them understand how AI can help them in their jobs, help them with job security as well, and provide more opportunities for them. That is the biggest thing that needs to be addressed. And I give a lot of advice in the book about how smart people are doing that.
And a lot of people focus on the tools themselves, but you talk about infrastructure and connectivity. Why are those pieces so critical before a company even starts?
Yeah. By the way, it's another reason why Cox Business wanted to partner with me, because, it is infrastructure is core to your business. Speed of processing has increased. The cost of storage for data has decreased significantly, but it ain't worth anything unless you can deliver data back and forth to the devices or that you're using that's deploying AI stuff. So I give some advice in this. I interviewed some executives from Cox Business about some advice they had about creating the right infrastructure for your business. You got to make sure if you're a business owner and you are going to be leaning into AI that you have talked to your infrastructure provider and make sure you're going to get the speed that you need. Otherwise, you could be wasting money on some of these investments.
And if business leader is watching and feels like they're falling behind, what's one practical step they should take right now to get ahead?
Number one is training. Again, you have a lot of these AI functionalities in your book. I have, when I talked to people and I wrote this book, I found there are a lot of smart business people that are leveraging AI by getting the word out to their employees how they can better use it. So my advice, and again, I write about this in the book, hire like a good consultant or a good trainer, talk to Microsoft, talk to Google, talk to your accounting software vendor, your HR platform, have them provide training for your employees so they can get over that fear that I talked about earlier, do their jobs better, be more productive, feel better about this technology, and frankly, be more profitable for your company. That's the step you need to take this year, is getting your people trained on this stuff.
And for companies that want to dive deeper into your work or learn more, where should they go?
Well, they can go and buy my book if you would like sometime this summer when it's released publicly on Amazon.com and other outlets. But for now, thanks to Cox Business, they partnered with me on this. They're making the book available completely for free. Go to cox.com, cox.com/AI-playbook. You can download the entire book and get a head start on your AI adventure.
Gene Marks, I want to thank you for joining me again.
Thank you, Dan. It's great speaking with you.
And that's going to do it for this week's episode of Rise and Unwind. Thanks so much for spending part of your day with us. If you want to keep up with the show, be sure to follow us online. You can find us on YouTube at Rise Unwind and on Facebook and Instagram at, you guessed it, Rise Unwind. For even more of the show, head to our website at riseunwindtv.com. Thanks again for watching, and we'll see you next time right here on Rise and Unwind. Maybe I should say it again. I don't think we said it enough times. Rise and Unwind.